Welcome back on your Wednesday. Let's dive right into the deep end. As the fentanyl crisis escalates, Whatcom County's executive signed an executive order directing county departments to take action and address that crisis.
The order recognizes fentanyl's toll on the community and lists more than 36 actions to expand efforts around prevention, intervention, treatment, aftercare, and coordination. Joining us to continue the conversation this morning is the Deputy County Executive, Kayla Schott-Bresler. Kayla, good morning to you.
Good morning.
Thanks so much for joining us. So before we dive into the actions, how big of a problem is fentanyl in Whatcom County?
Fentanyl is an extremely serious problem in Whatcom County, as it is across Washington and the country. We had 136 confirmed fentanyl deaths in 2023. It's tragic. Children, people of all ages and all walks of life are dying. From a high level, the numbers are strikingly similar to what we experienced during COVID, but a closer look reveals an even more frightening situation. People can't acquire immunity from addiction. Fentanyl is a poison that people with a disease seek out, and it takes enormous resources and time to heal from someone from addiction. It's not something that can happen quickly, or that someone can simply take a medication and get better overnight.
Yeah, we know you guys aren't alone up there in Whatcom County. So what are some of the recommended actions to address this crisis head on?
Well, the executive order has actions, as you mentioned, across the prevention, treatment, and recovery continuum. I would say one of the major intervention points is the few hours and few days immediately post-overdose, which is really a gap in our current system of care. We need to do something therapeutic for people during that time. And I will also say we need to drastically expand the availability of inpatient and outpatient treatment, as well as recovery supports like housing.
Has the county council discussed next steps yet or any possible solutions?
You know, the health department is working hard to assemble an emergency response plan, which is going to be delivered to the executive and the council at the end of May. The internal steps we plan to take will be gradually implemented over the next 2 years. This is a pretty ambitious work plan, and so we will be working on the big ticket items immediately and scaling up some of the longer term strategies like recovery housing over time, and certainly significant budget actions at the county level, the state level, and the federal level are going to be necessary to accomplish this.
Kayla, in the original release that we got from the county executive, it said that county resources and tools alone, not enough to fully address the drivers of addiction and the need for recovery and support. What does that support look like?
Yeah, I mean, first and foremost, there's policy and budget level action at the state that we need. We have to get Medicaid reimbursement rates up if we're going to expand outpatient and inpatient treatment. That requires state legislative action. We're hoping the state legislature takes that action this coming legislative session. We also need significant amounts of capital funding for treatment, housing, and recovery facilities. At the federal level, we need federal investment at the scale we saw with COVID. We're not seeing a discretionary emergency response fund here. We're not seeing an Operation Warp Speed. It feels like the federal government needs to step up a lot more if we're going to solve this problem.
I just had one more question for you that I was just thinking of. You know, you talked about the numbers from 2023, which was pretty significant for Whatcom County. Are you seeing kind of the same trends so far in 2024? I know we're only, 5 months in now, but are we seeing some of the same levels that could be on par for Whatcom County this year compared to last?
Yeah, I spoke with our health officer the other day, and we are seeing an overall trend that's decreasing since last year. That's positive, but we also have clusters of overdoses where we can have multiple overdoses in any given day and in any given week. So I would say it's too early to tell.
Well, thank you so much, Kayla, for putting a spotlight on Whatcom County for us and letting us know what's going on over there.
Thank you.